Good morning, BSRT2 students. So the last time we have discussed the overview of radiographic exposure technique factors. So we have defined, of course, we have identified first and defined each of the following technique factors. So we discussed all about the KVP, the MA, or milliampere exposure time. So combined together, MA and exposure time, so forming the MAS. And we also identified and as well as defined the SID, or the source to image receptor distance. So this morning, we will discuss the radiographic exposure technique guides. So since you are novice or new in this profession, so we said that before we said that this subject will be your eye-opener to becoming a good quality radiographer. So either this discussion will help you form your exposure technique factors in the near future, hopefully. So it goes with the saying that be picky with who you invest your time in. Wasted time is worse than wasted money. So kailangan there should be a guide first, to whatever you want in the future. So since you are already second year student, probably you are already convinced to become a radiologic technologist. So this saying is also applicable to the hospital. Kumbaga, magbalyo naman lahin usang equipment or radiology facility should be the best na lang na facility para the good investment mas ayun nga long term iti marerender na service itong equipment. And of course, the best investment in a way or in another, parang mas mag-give siya maupay na service to our client or to the patient. So ganun yun. So this morning probably my intention is to help you guide you in whatsoever endeavor being a radiologic technologist, na you can create or you will have an idea ano na mga machine ito pwede ma-handle in the near future. But it does not necessarily mean nga because of this discussion magiging choosy na kita in the future. What if iti hospital ganun let mo offer, so di rin na ka mo magiging maupay nga radtech. So it's not what I'm talking about. Kailangan maaram kita to handle each type of equipment or each type of generation to another. Para dire karagsigon nga good radiologic technologist la kita kun maupay an makina. Good radiologic technologist gyap kita bisan dire good ganon kabongga it machine sa hospital. So ganon yon. That's what my intention is all about. Okay, so let's discuss these different technique guides. So it says here that KVP, MA, exposure time, and SID are the principal exposure technique factors. We already know that, diba? Considering our discussion the last time. So it is important for radiologic technologists to know how to manipulate these exposure technique factors to produce the desired optical density, radiographic contrast, image detail, and distortion in the finished radiograph. So as what I've been telling you, your radiographic image or your X-ray film is your identity in our profession. Kung maganda ang optical density, maganda ang contrast, yung detail, so walang distortion sa image, so people might say, or your co-workers might say that you are a good radiologic technologist. Dito kasi, di ba, it's kailangan balance yung knowledge. So knowledge on KVP, MA, exposure time, and SID. Kailangan balance din yung skills. Kaya nga, kailangan we know how to manipulate, how to deal with this alam na natin kung ano yung KVP, yung MA, exposure time, and SID. Kailangan alam natin how to apply that into practice. And of course, kailangan balance din yung attitude. It's parang bisan na naka-online kita, naka-virtual class kita, parang nagigauge ko gihapon your attitude towards these subjects that I've been handling. Parang little by little nakikilala ko kamo because the way you respond, parang iba may pagkareklamador ganon sa online. Labi na kay Sam, hinay signal, sir. Parang, ano ba ini? Ganun. Pero siguro, it's just my impression for now. Dere ko pa kasi kamo ganun kakilala, no? But what I'm telling you is, kailangan balanced ato knowledge, our skills, and of course, our attitude para maging good quality radiologic technologist kita. So, it is not necessary, however, to become creative with each new patient. For each radiographic imaging system, a chart should be available that describes standards or standard methods for consistency producing high-quality images. Such aid is called radiographic technique chart. So radiographic technique charts are tables that provide a means for determining a specific technical factors to be used in a given radiographic examination. So like in our illustration, so kung makita mo naman na paprehas it body type, di ba? Paprehas an age, paprehas an tawag ito namon kasi body habitus, the shape and the form of the body patient. Kung feeling mo naman paprehas naman, so why do we have to sabi nga dito, why do we have to apply different technical factors? What if you have 100 patients per day? Alangan ba naman mag-iiha kita sayo lang nga pasyente? Diba? Kung paprehas naman it body type or pagkita mo, pag-assess mo, nagkakaparehas, why don't we use the same technical factor? Halimbawa, 50 patients dito, puro an x-ray, puro hand. So why do we have to apply different technical factors? Kung aram naman naton na siyahan pala na hand x-ray maupay na ang quality, why do we have to deviate from another technical factor? Kumbaga, we have to create a radiographic technique chart na magiging guide naton ultimately throughout our radiographic procedures. So, mautot gamit. So, kumbaga, since you are still novice, so you are still new in this profession, of course, kailangan naton may guide naton. And our guide here is the radiographic technique chart. So, pag kita mo, halimbawa, sulat yung kanina, 100 patients, so 50 dito hand, so may din na kita guide. Tapos, may mga technique factors kita, like for example, sa skull. So, pag abot pala pasyente, position mo, tapos aram mo na kung ano't imo technical factor na gagamiton kasi you already have the radiographic technique chart. So, ganun yun. As sabi nga dito, it's not necessary to become creative with each new patient. Kung halimbawa, ini mo pasyente o pito dayon kay pito nga BTS, pag kita mo, paprehas naman tera kalawas, why don't you just use, although kung mag-change ka man technical factor, di siya ganun ka-major. From one patient to another patient, parang may similarity of technical factor because you already applied what you have written in your radiographic technique chart. Ano? I hope nakukuha niyo takon karegsingon. So yan. So in our university, we have our technical factor chart. And I've said this is just a guide. So this has been tested, of course, kasi this is requirement to DOH. And of course, this is based on calibration of your X-ray machine. So most facilities select a particular type of chart for use and then prepare similar charts for each radiographic examination room. So ikakat ko lang muna dyan. So halimbawa your X-ray machine, your hospital has different X-ray rooms. Okay, so dito nga, this one, in machine ni is, let's say, Shimadzu. So, you have the technical factor chart there. So, this X-ray room naman, your X-ray machine is, let's say Siemens. Diba? So, X-ray room 3 naman, Samsung. So, iba-iba iti mo technical factors. Of course, kasi iba-iba nga machine. So we don't have any standard here yet. Labi na kay each company has may danera tinatawag na mga uniqueness. Oo. So, the type of chart selected usually depends on the technical director of the radiology in place, the type of imaging system available, the screen film combination used, and the accessories available. So, sometimes, nagdi-differ kung, okay, so, halimbawa, sabi nga dito, director of the radiology in place, in consultation with the different radiologists, ng mga doctors na nasa hospital, syempre sila yung final judge ng ating X-ray film. So, nakasugad dito nga, halimbawa, masugad dito nga, constant ng machine is 40, but gusto ng radiologist na dagdagan or bawasan, so sila din yung magdi-decide. The type of imaging systems available. Kung analog pa siya or digital, syempre nagva-vary din yon. Screen film combination. So, depende sa product. Like for example, Kodak and Kodak. Kodak yung film at saka Kodak yung cassette. Or let's say Konica or whatsoever. Kasi minsan, there's a variation. Pag nag-change kayo ng one type ng film, tapos hindi siya ganun ka-match doon sa cassette, so nagkakaroon ng slight na problem. And the accessories available. Kung dark room, kasi minsan there's also an effect kasi sa dark room. Like the processing solutions. Okay, so kung bago, kung medyo luma-luma na, so nag-iiba yung ating technical factor. So all of these are considered to become or to create a good radiographic technique factor chart. Although sasabihin natin na halimbawa nakalagay na dyan, may hand factor na tayo, so it doesn't mean na kung bago yung processing solution, tapos after 30 days, ganun pa din yung technical factor, hindi na yun applicable kasi nagbabago yung ating processing solutions. So, ganun yan. Anyways, sabi ko, this is just an eye-opener pa naman na lesson. Parang introductory pa lang din tayo. Although, last na to kasi next week we will be discussing more about the technical factors na. Okay. So, before preparation of the radiographic technique chart begins, so the X-ray equipment must be calibrated by a medical physicist and the processing system must be thoroughly evaluated. So, ito. Sabi ko nga last time, kailangan there should be a calibration muna. Then, ayun. So, proceed ka with your technical factoring. So, proceed ka with the technical factor chart. So, based on calibration, halimbawa, sasabihin ng physicist or ng engineer na ganito yung calibration niya. So, the constant is 40, ganon. So, yun, magdi-decide ka na what will be your technical factors. So, again, kailangan calibrated muna yung X-ray machine. So, we have first our radiographic exposure technique guide if we are using a variable KVP technique chart. Variable, so meaning nag-iiba-iba it KVP sa technique chart. So, pansinin mo dito, so, may significant changes. So, pag iti thickness na sa 5, 58. Pagka di sa 6, nag-60. So, every thickness has different KVP. So, the variable KVP radiographic technique chart uses a fixed MAS value and a KVP that varies according to the thickness of anatomical part. So the basic characteristic of variable KVP chart is inherently short scale of contrast. So in general, exposures made with this method provide radiographs of shorter scale of contrast because of the use of lower KVP. So, remember again class that KVP is the controlling factor for the scale of contrast. Kaya nga ulit-ulit siya na sinabi dito, di ba? Sabi nga dito, the basic characteristic of variable KVP technique chart is short scale of contrast. So exposures made with this method provide radiographs of shorter scale of contrast because of the lower use of KVP. So anyways, next week, kasi magdi-discuss na tayo ng KVP, so we will go deeper what is contrast and how it is related with KVP. So, ito lang muna. So, with the use of variable KVP technique chart, we have to expect that images created from this chart are of shorter scale of contrast kasi nga gumagamit tayo ng low KVP. Ano? So, exposures directed by the variable KVP chart usually results in higher patient dose and less in exposure latitude. So, cut ko muna dyan. Kasi, based sa radiation protection protocol, the highest possible KVP with the lowest possible MAS provides the best radiation protection for the patient. So, sabi nga natin kanina kasi gagamit tayo ng mas mababang KVP, so it usually results in higher patient dose and less in exposure latitude. So, for success, the radiologic technologist must be accurate in measuring the anatomical part before selecting exposure factors from the chart. Without such care and attention, the anatomical part may not be fully penetrated because of the lower KVP. So, as you can see in our illustration in the picture, so Ms. Federnales is measuring a certain part to or the anatomy of interest sa ating patient who is Mr. Sean Alvarez. So, ito gagamit tayo dito ng simple instrument. Pagkita nyo, ruler, but that's what we call the caliper. So, because we have a formula kasi to find for the KVP. So, thickness times 2 plus constant. Kaya, kailangan our measure must be accurate. Diba? Kasi nag-iiba kasi kung makita mo kanina. So, every centimeter, nag-iiba yung KVP. Okay. So, kailangan we are very keen. Pero sabi ko nga kanina, depende pa din yan sa processing solution natin. May epekto pa din yan. Kasi pag luma-luma na yung ating processing solution, okay, so medyo nag-iiba din tayo ng technical factor chart. So, ayun. So, that's the essence of variable KVP technique chart. And to prepare a variable KVP technique chart for anatomical parts, the same procedure is used. So, because radiologists prefer similar contrast scales for examination of the same anatomy, the variable KVP technique chart has been replaced largely by the fixed KVP technique chart. So, hindi ko lang muna ito i-discuss, kasi this is on the following section. So, dito tayo. To prepare a variable KVP radiographic chart for other anatomical parts, the same procedure is used. So, salamat na lang kasi sa UEP, we have these equipment. So, makita mo, this is now our anthropomorphic phantoms. Para we don't have to keep guessing. So, pwede tayong magkaroon ng mga experiment. That's basically yung ginawa ng mga former BSRT2 students. So that they can create a good radiographic technique chart. So, nagkaroon muna sila ng several exposures. First, in-expose yung hand. So, after concluding that the technical factor for hand, let's say, gumamit sila ng 45 kVp, so, nag-add sila ng 5 para sa forearm, tapos 5 para sa arm, tapos yung shoulder nila is the same technical factor sa chest. So, ganun yung mga ginawa nila. Oo. So, naging guide muna nila yung ating anthropomorphic phantom. Same as true with the skull. So, kaya, kailangan very keen yung ating pagkakagawa niyan. So, ganun. So, ano ulit yung variable KVP technique chart? Kasi, nagkakaroon siya ng iba-iba yung KVP sa bawat thickness. Tapos, same naman yung, sabi nga dito, fixed MAS value. Pero that's applicable only to parang nagkakasimilar na mga anatomy of interest. Okay, so like here. So, same yung MAS. Yan. So, yun. Okay, so that's the variable KVP technique chart. Next, we have the fixed KVP technique chart. Fixed kasi hindi na nag-iiba-iba. Okay? So, the fixed KVP radiographic technique chart is the one used most often. So, it was developed by Arthur Fox. So, it is a method of selecting exposures that produce radiographs with longer scale of contrast. So, the KVP is selected as the optimum required for penetration of the anatomical part. This usually results in somewhat higher KVP values for most examinations than are produced by the variable KVP technique. For each anatomical part, there should be an optimum KVP. Kumbaga, sinasagad yung KVP. Ano? Hindi tayo nagme-measure na dito. Kumbaga, yung range natin sa chest is for sthenic patients. So, gumagamit tayo ng 75. Yun, sagad na yun. 75 or 76. Maximum yung ating or optimum yung ating KVP. Ano? So, by the way, nasa picture is the book of Dr. Arthur Fox. Diba? Sabi nga dito, he was the one who is credited to the development of the fixed radiographic or fixed KVP radiographic technique chart. So, fixed. So, hindi na changing yung KVP but it is ginagawa natin again optimum. Sinasagad natin yung KVP. Once selected, the KVP is fixed at the level for each type of examination and does not vary according to different thicknesses of the anatomical part. So, same yung gagamitin nating KVP all throughout the chest. For example, chest radiographic procedure, skull procedure. So, sinasagad natin si KVP. The MAS value, however, is changed to provide the proper OD or optical density. So here, in the fixed KVP radiographic technique chart, si MAS naman yung varying. Si MAS yung naiiba-iba. So now, you can already have an idea ano ba yung saan ka mas magiging comfortable sa variable KVP technique chart or dito sa fixed KVP technique chart. Doon sa si KVP yung iniiba-iba or dito sa si MAS yung nag-iiba-iba. So, for example, all examinations of the knee might require 60 kVp with MAS adjusted to accommodate 4 different thicknesses. Oo. So, yun. No? So, mag-isip-isip ka na. Which means, yung mga panahon talaga, yung mga tao hindi parehas sa lahat ng panahon. Nagbabago-bago. Wow. Hugot. Next. Because the fixed KVP technique usually requires higher KVP, one benefit is of course the lower patient dose. Di ba sabi natin kanina, the highest possible KVP with the lowest MAS offers the lowest possible radiation dose. So there is greater latitude and more consistency with exposures of the same anatomical part. Okay? So, yan, that's isa yung mga magandang benefit na naidudulot ng fixed radiographic technique chart. Measurement of the part is not critical kasi nga sinasagad natin because part is usually grouped as small, medium, or large. Okay, hugos. Oo. Sakto-sakto la. Oo, di ba, atleta. Tapos, mga gimbayan na kusina. So, for most X-ray examinations of the spine and trunk of the body, the optimal KVP is approximately 80 kVp. So, approximately 70 kVp is appropriate for soft tissue of the abdomen. Kumbaga, actually ito for this modern day times, actually, hamubo pa siya nga KVP. So, for most extremities, the optimum would be 60 kVp. Yun. Sige lang kay maumanin tato libro. Usually now, we are using more than 80 for the abdomen. Oo. Pero, yun, kasi nga, ito yung mga recommendations ng ating book. Okay, so fixed. Now we have high KVP technique chart. Kumbaga kanina sagad, ito mas sasagarin pa, no? So the selected or KVP selected for high KVP technique charts is usually greater than 100. Kaya tipid tayo sa kuryente. For example, overhead radiographs for procedures in which barium contrast medium is used would use 120 kVp for each exposure. High kVp exposure techniques are ideal for barium work to ensure adequate penetration of the barium. Okay, so since wala pa naman kayong positioning or special radiographic procedures with contrast, so it says here that mas maganda daw yung contrast procedures na ipe-perform natin will be combined with high KVP technique factor chart para mas ma-appreciate doon yung contrast na in-inject or in-administer sa patient. So to prepare a high KVP technique chart, the procedure is basically the same as for preparing the fixed KVP technique chart. So all exposure for a particular anatomical part would use the same KVP, and obviously the MAS would be much less. So an additional advantage of high KVP exposure technique is reduced patient dose. Ulitin ko lang nga, ulit-ulit. So the highest possible KVP with the lowest MAS offers a lower patient radiation dose. Kaya sabi nga, radiation protection wise, mas recommended yung fixed KVP and high KVP technique factor chart. Okay, now let's come to automatic exposure control or AEC. Bakit siya naging automatic? So automatic control X-ray systems are not completely automatic. It is incorrect to assume that because the radiologic technologist does not have to select KVP and MAS settings and each time for each examination, a less qualified or skilled operator can use the system. Hindi pwede. Dapat, the patient positioning must be absolutely accurate because the specific body part must be placed over the phototiming device to ensure proper exposure. Ayun, hindi naman siya sinasabing automatic na wala ng dark room and all. Kasi dito, it's still an analog type. No? The dark room pa rin tayo. So, naging automatic lang siya because of the phototimer. Ano nga ba yung phototimer? To. So, radiation exposure in most X-ray imaging system is determined by automatic exposure control or the AEC. AEC incorporates a device that senses the amount of radiation on the image receptor. Okay, so through an electronic feedback circuit, radiation exposure is terminated when sufficient number of X-rays has reached the image receptor to produce acceptable OD. So, actually here, may dalawa tayong automatic exposure control system. Una, we have ionization chamber, and the other one, of course, the phototimer. And this part will be discussed more in your equipment maintenance. So, the essence here is, okay, so to image with the use of the automatic exposure control, the radiologic technologist selects the appropriate KVP, MA, and backup time, as well as proper sensors and optical density. Exposure is terminated when the image receptor has received the appropriate radiation exposure to correspond the acceptable OD. So, halimbawa, yung technique factor chart na nilagay mo doon sa console is let's say 86, pero payat yung pasyente. So, anong mangyayari sa OD? So, it will still produce a good quality OD. Kasi, finifilter kumbaga yung radiation na marireceive ng image receptor. So, instead na that will tend to have a darker image, so kumbaga, dinidisregard na niya yung excess na technical factor na nilagay mo doon sa console. So, ganun yung AEC. Okay, kasi na-receive na niya yung appropriate na technique para sa chest. So, ititimpla niya yung chest. Pero pag underexposure, that's another problem. Kumbaga, isasagad mo yung technical factor. But, i-create lang niya yung image na gusto mong mangyari. I-disregard na niya yung yung sobrang technique na ni-input mo sa console. So, with AEC devices, usually 2 or more exposure sensors are available for control. For instance, the 3 radiation sensing cells may be available on the radiologic technologist is responsible for selecting which of the sensors should be used for examination. During a chest examination, if the mediastinum is the region of interest, only the central sensing is used. If the lung fields are principal importance, the 2 lateral cells are activated. So, ito siya, na mga sensors, you can manipulate that sa console. May mga selectors na tayo doon sa console. So, you can select the central or, sabi nga dito, lateral cells. Yun. So, another thing na mangyayari is, halimbawa, nag-skull x-ray ka tapos na-click mo doon sa console 2 lateral cells, walang mangyayari sa film. Walang may expose. Halimbawa naman, nag-chest x-ray ka tapos na-click mo, double yung na-click mo, 2 lateral cells tapos central, overexposed yung film. Ganon siya ka-sensitive. Kailangan may presence of mind ka when you are using the AEC or the phototimer. Kasi gusto mo niyang i-filter yung radiation, pero kung na-input mo doon sa console is mali yung lalabas na image. Ganon siya ka-sensitive. Ayun. So, microprocessors are incorporated into operating consoles. A microprocessor allows the operator to select digitally any KVP or MAS setting, and the microprocessor automatically activates the appropriate MA station and exposure time. Ayun, may tinatawag tayo dito, falling load generators. The microprocessor begins with the exposure at a maximum MA settings, then causes the tube current to be reduced during exposure. So, the overall objective is to minimize the exposure time to reduce motion blur. Sige lang. This terminology is the falling load generator, saturation current. So, all of this will be discussed further in your equipment maintenance next semester. Next, we have anatomically programmed radiography. Take note automatically. Anatomically. So, anatomy. So, nakaprogram siya based sa anatomy nga part. Okay? Body part. Okay, next. A widely used electronic technique for patient exposure control is referred to as anatomically programmed radiography or APR. APR also uses microprocessor technology. Rather than have the radiologic technology select a desired KVP and MAS, graphics on the console or on a video touch screen guide the technologist. So, this was the console that I was using way back when I was working still at the Leyte Provincial Hospital. So, ito yon, anatomically programmed siya. So, if you can see in here, so may mga selection yan, yung small, medium, or large na patient. Mga hugos, sakto-sakto lat kalawas, tapos medyo tambok-tambok na, no? So, di naman siya stereotyping, but because here in radiography kasi, we have body habitus nga tinatawag natin. The hypostenic, stenic, and hyperstenic. Ayun. So, depende sa body mass index, depende sa shape and form ng body, So, importante yan. Maklik mo muna. And then, makikita mo dito, may mga icons dyan. So, for example, dyan, may nakalagay na chest. Yan. Pag maklik mo yung body part, tapos chest, so automatic may lalabas na technical factor. Kasi nakakalibrate yan according sa x-ray machine. Yon. So, hindi ka na masyadong ma-effort na magme-measure and magko-compute. Halimbawa, nilagay mo dyan, clinic mo yung small, tapos nag-click ka ng chest, so may lalabas dyan na technical factor. So, again, anatomically programmed radiography. So, may mga factors na nakalagay sa machine. So, based sa anatomy and the thickness, of course, ng patient. So, hindi na masyadong ma-effort. Sabi nga dito, the radiologic technology select the desired, no. So, tinatouch na lang natin, no. Graphics on the console or touch screen guide the technologist. Okay? Next. To produce an image, so radiologic technology simply touches an icon or a written description. Yun nga, sinabi ko kanina, of the anatomical part to be imaged and the body habitus. Yung size or form ng body, either small, medium, or large. So the microprocessor selects the appropriate KVP and MAS settings automatically. No? So, binigay na ng console lahat sa'yo. Pag-touch na lang. So, the whole process uses AEC. Yon, combination pala ng automatic exposure control at saka anatomically programmed. So, we can say that pwede palang makombine. Halimbawa, high KVP tapos anatomically. Pwede yon. Kasi nga, kung makita mo dito, siya, sthenic, yung body habitus, tapos chest, pero yung KVP niya is 85. Sinagad, di ba? So, we can say that this is anatomically programmed. At the same time, gumagamit siya ng high KVP technique chart. Yun. Pwede palang makombine. So, the whole process uses AEC, resulting in a near flawless radiographs and fewer repeats. However, precise patient positioning relative to phototiming sensor is still critical for producing high-quality radiograph. So, hindi naman kesyo naka-AEC tapos na anatomically programmed, masyado na tayong maging relax sa ating procedures. Kailangan maganda pa din, precise pa din yung positioning, di ba? Para mas maganda pa din yung kalalabasan ng X-ray film. So the principal APR or anatomically programmed radiography is similar to that of the automatic exposure control. With the radiographic technique chart stored in the microprocessor, so naka-programmed, the service engineer loads the controlling program during installations and calibrates the exposure control circuit for the general conditions of the facility. So, baka one of these days, pumunta kayo sa X-ray room ng University of Eastern Philippines, may kita nyo may nakalagay doon APR. So, pwede tayong gumamit ng APR or anatomically programmed radiography. But if you prefer na gumamit ng variable, pwede din yon. So, it's a combination ng console. Hindi lang siya nag-o-offer ng isang technique chart, but this is actually gino-offer siya para sa imo comfort zone. So you can use variable, you can use fixed, you can use high KVP as well as APR. So ganun pala yung technology natin. The radiologic technologist needs only to select the part and the relative size before each exposure. Kita nyo naman kanina. The programmed instructions, however, must be continuously adjusted by the radiologic technologist until the entire panel of examination is optimized for best image quality. It doesn't mean na kesyo nagbigay na siya ng technique factor, hindi mo pwedeng baguhin. Pwede mong i-adjust yan. Halimbawa na select mo, okay, so sthenic, tapos chest, lumabas siya 85, pero mas gusto mo nasa 76 lang. You can adjust, pwede mong bawasan, okay, so pwede ka mag-click this part para mabawasan siya, or pwede mong dagdagan, pwede mong bawasan to, pwede mong dagdagan. So it's still ikaw pa din yung magdi-decide. Machine lang yan. Ikaw yung radtech, di ba? Okay, so next we have digital technology. So kung nahuhubya ka na mag dark room, so ito is mas maganda mo, digital technology. I don't know yet kung katarman may digital na tayo. Digital technology, CR or DR. Okay, so presently an acceleration in the conversion of screen film radiography or the analog to digital radiography, DR, is occurring. Digital imaging began with the computed tomography or the CT scan and magnetic resonance imaging. So this picture nakita ko lang siya sa Facebook and medyo nakaka-relate din naman ako. So unang na-discover yung X-ray or unang na-produce X-ray machine. pero nahuhuli na siya sa development. So, in your CRDR na subject next semester gihapon, puro na lang next semester, no? So, madidiscuss ito. What were the reasons kung bakit na-delay yung development or let's say improvement or yan ni radiography. So, mas nauna nang tumanda si MRI, CT, nahuli na si X-ray. Ano? Sige lang. So, Isan Sameh has reported a clever approach to describing and identifying the various DR imaging systems, a capture element, coupling element, and collection element. So, pag di siya gumagamit na ng darkroom, so we can say that that is already a digital radiology. Oo, DR na siya. But according to Isan Sameh, pwede pa natin yan categorize into different forms ng DR. Depende sa capture element, sa coupling element, and collection element. So, di na ako mag-go deeper with the discussion or in this discussion. Kasi, this is part of, laki part. So, ini siya kasi discussion siya sa CR or DR, Computed Radiography and Digital Radiography next semester. Kumbaga, ipapakita ko lang one of the technique guides na pwede natin magamit din is the digital. Digital technology. So, digital radiography or radiography was introduced in 1981 by Fuji with the first commercial computed radiography CR imaging system. After many improvements that were made over the next decade, CR became clinically acceptable and enjoys widespread use. 1981 pa siya in some other countries. So, which means, dito talaga sa Pilipinas, medyo nahuli tayo sa mga technology. But, hindi naman applicable kasi in the cellphone, may mga iPhone 12 and everything, pero parang nakakahabol din naman yung Pilipinas. But sa ibang aspeto, kasi sabi nga dito, 1981, in-introduce pa lang dito sa Pilipinas, medyo nahuli tayo ng ilang dekada. Okay, so according nga to Isan Sameh, iba-iba yung pag-categorize ng DR. So, una, yung category is, computed radiography. So, sa computed radiography, or today, the medical imaging is complemented with multiple forms of DR in addition to CR. So, isang form ng DR is computed radiography. CR computed radiography, diri kay comfort room. Tapos DR, diri siya kay delivery room. Digital radiography. At this time, CR is the most widely used DR modality. And although other DR systems are increasingly in use, it seems there will always be a need for CR because of its unique properties. Sige, ganito na lang kasi hindi na ako nag-go deeper. Yung CR kasi, gumagamit pa siya ng cassette. Pero, filmless na siya. Wala nang film inside that cassette. Iba na yung property kasi. Sabi ko nga, this will be discussed further in your CR and DR na subject. So, mag-x-ray ka, tapos mayroon kang IP imaging plate. After mong mag-x-ray, so ipapasok siya dyan sa reader, IP reader. Oo. So, iba-iba din dere siya ganun ka-standardized. Merong ibang IP reader na parang, parang TV ng inyong bahay. Doon siya i-read. Tapos, after that, lalabas na yung image mo. Hindi ka na magda-darkroom, di ba? Masakit iba. Wow, social, sir. Yun. Kailan maupay para makagamit kahin mga, mga high caliber na mga machine. Balitaw. So, we have digital radiography. Kung kanina, nagamit pa siya didihin ang imaging plate, ano kaya't kaibahan niya digital? So, I guess, na-discuss gihapon ini when you were still in your RT introduction. Tapos, in your informatics, papasok din to. So, hindi kayo mahang. So, several approaches may be used to produce digital radiographs and it is not yet clear whether one of these approaches ultimately will prevail. Furthermore, the vocabulary applied to digital radiography is not yet standard or universally accepted. So, sa CR kasi, DR, kita mo, wala na tayong imaging plate, although may vertical grid device, So, dito kasi may mga sensors. May sensors dyan. After mag-x-ray, so wala ka nang dadalhing imaging plate, wala nang cassette and all. So, after mag-x-ray ng RadTech, so nandito na yung image sa computer. Yan. So, furthermore, pwede mo pang ma-adjust yung image na yan dyan sa monitor. Yan. So, probably yung masasabi ko lang na disadvantages kasi dito sa CR and DR, over-reliance na kasi tayo sa facility, hindi na tayo nagko-compute. So, one time, nakita ko, so if you can still remember, may nakita kong post sa Facebook ni Mayor Isko Moreno na nag-purchase yung Manila ng bagong X-ray machine, and it was digital form of X-ray machine. Kaya lang, medyo nababash doon yung RadTech. Kesyo daw, ang pangit ng kuha, ganon. Kasi sabi ko nga, nagkakaroon na tayo ng over-reliance sa equipment. May tinatawag na tayong technique creep. Technique creep versus dose creep. Ini siya madidiscuss sa next semester sa UCRDR. Kasi inaatang na natin lahat ng obligasyon sa machine. Hindi na tayo nagko-compute. So, nagkakaroon ng technique creep versus dose creep. Yun. So, other than that, ito naman yung ikinaganda kasi gumagamit na tayo ng digital technology. Kung dati, pagpasok ng pasyente, so, sasamahan natin siya sa x-ray room, position, tapos, before that, maglalagay muna tayo ng cassette doon sa dark room. Tapos, after that, perform na tayo ng procedure. Pupunta tayo sa dark room, magpa-process tayo ng film. Tapos, lalagyan na naman ulit yung cassette ng film. Tapos, ipapadry or yahang yung x-ray. Hintayin ng for how many minutes pag matuyo. Tapos, kung ma-found out natin na pangit yung kuha, pwede tayong mag-repeat. Pag maganda naman, so pwede na nating ipasa sa radiologist for interpretation. Tapos, sasama na natin yung pasyente. Okay na po yung procedure. Ganon, So, with the digital radiography, so, after mong samahan yung pasyente sa x-ray room, so, perform mo na yung procedure. Tapos, check mo na agad kung okay yung kuha. Kung hindi, pwede mong i-repeat. Or, kung okay na, pasa mo na for interpretation. And then, sa imaging informatics, pwede mo nang ipasa lahat ng details sa computer system ng inyong hospital. Yun yung ikinaganda niya. So, di naman masama yung improvement. Kaya lang, kakaroon lang tayo ng over-reliance. Okay. So, that ends my discussion. Probably, sabi ko nga, ends my introductory part ng principles of imaging. Next week, we will start with the actual, yung magko-compute na tayo ng KVP and other technical factors. So, my question is, which of the technique guides will be easy for you? So, probably, sasabihin nyo, sir, of course, digital kasi wala ng dark room. Yan. But, remember class, sabi ko nga kanina, it doesn't only depend on the technology. Sa first na slide, di ba, be picky. But sometimes it is dependent on the person itself. Kahit nga sabihin nating pangit yung facility ng hospital, if you as a person decided ka to produce a good quality radiograph, a good image, maganda pa din, di ba? Kahit analog pa lang, maganda pa rin yung kuha comparable to other technologies or other exposure technique guides. What I'm trying to say here is, being a student of the University of Eastern Philippines, BSRT student of the University of Eastern Philippines, our intention here is whether kung ano man yung gamitin nating facility or equipment, magiging maganda pa din yung kuha ng or magiging maganda pa din yung kuha natin. 'Di ba? Kasi nga, this is our radiograph is our identity for our being a radiologic technologist. Okay? So again, hindi yan nasa machine. Nasa skills, nasa knowledge, and of course, nasa attitude yan. Okay, so inspired na ba kayo? Or baka may mga kaganapan pa kayo na parang naboboard kayo sa buhay? So how's your journey as BSRT student so far in this time of pandemic? Oo, kasi sometimes sabi ko nga, may mga factors na binago si pandemic. Parang slight, kaya nga kahapon I've been trying to connect with some of my students. Baka naman ano na yung mga ginagawa sa buhay. So, okay, so keep pushing lang. So, let me share some of the significant students that I have handled who had their humble beginnings but now they are enjoying the time of their life working somewhere working abroad. They are my former students. There is a UEP but in Holy Infant College. Thank you so much nga they allowed me to use their pictures para some sort of motivation. As I've been saying, ayaw ka mo kahulop, 'di ba? Keep pushing lang. So, inihirang mga students, nagtikang gihapon, mga variable KVP technique chart, fixed KVP technique chart. Until now, they are syempre, they are working abroad. Mga ganun naka-sophisticated nga mga machine. So, thank you so much kan Mr. CJ Pedrosa, kan Kuya Paul Matnog, ngayon kan Mr. Jerwin Bation. So, kung baga kilala niyo sa Facebook, so these are my former students who are now working abroad. Ngayon, my intention is, kaya naging paparayo ko iyo is, in the near future, magiging sugad gihapon ka mga era. Diba? So, that ends my discussion, and thank you so much for listening. If you have inquiries, so if you have questions, so we have different platforms, alam nyo na yan. And, we will have a long quiz the next meeting. So that ends my lecture, and keep safe again, and goodbye.